What's up, guys? Who knows what that is right there? That chest tube. All right. Today we're gonna talk about two types of chest tubes, but more specifically one. Two types of chest tubes you need to know for your critical care exam is your mediastinal chest tube, which is gonna go in the chest after you've had a cardiac procedure. It gets placed into the pericardial space to get excess blood out after the procedure. All right. And the one we're gonna talk about more so is the pleuritic chest tube. This is the chest tube that's going to go into the pleural space because you have air and or blood causing in the pleuritic space causing the lung to collapse. Okay, so you're not getting proper oxygenation. Right now, if you're going to have a pneumothorax, if you have a pneumothorax and you're going to have a chest tube placed, there's usually two places going to be either the second intercostal space midclavicular or the third intercostal space midclavicular. Right, reason being air rises, right? So that's why they place that there. If you have a hemothorax, that's going to get placed in the fifth intercostal space mid-axillary. All right. Now, some things that you need to know about this chest tube. This space right here that has the water, this is the water seal chamber. All right. If you have a hemothorax, there should be no continuous bubbling in that space. All right. There may be intermittent bubbling, which is okay. There may be rise and fall based on your inspiration and expiration. That's okay. That's all normal. But there should not be continuous bubbling. And this is where you have to read those questions very carefully so you don't get tripped up. Now, if you have a pneumothorax, there will be continuous bubbling in that chamber. All right. Now, when that continuous bubbling stops, that usually means that your lung has fully expanded, all right? And if it starts bubbling again, then for some reason it has collapsed once again. So you want to keep an eye on that. Now, it's very important that at the beginning of your shift, you are marking where your line is with the blood, okay? That way you know how much of this blood is going to be yours to document, right? After that line that you marked, that means everything past that line is yours. And you're also able to identify if there's excess blood coming out. So there shouldn't be no more than 200 mLs coming out per hour. That's a concern. You want to raise that to your provider. Now, these chest tubes should usually be connected to suctioning, all right? And that's where the setting is going to be. It's usually -20, but you'll see in the order exactly what it needs to be set at, okay? This little tube right here that has the clamp, one thing you need to know about that clamp, you never want to be clamping that tube unless you have a provider tell you directly, okay? One reason you may clamp the tube in the case of an emergency is if that system breaks and you need to exchange it real quick. You need to clamp the tube really quickly while you get another chest tube and replace it. What you can also do, as opposed to clamping it, is you could take the end of that tube and place it into a cup of water, right? That way you keep that one-way chamber, that seal, okay? It kind of simulates what's going on over here with that water seal chamber, all right? If you happen to find a clot inside the tube, you should not be milking, all right? You don't want to be milking the tube. The water seal chamber also may have some bubbling, and it may be due to a leak. And what you're going to do is you're going to start at your patient. Anything you ever do starts at the patient, right? If your vent is beeping, if there's oxygen, the patient's desatting, you always start with the patient, okay? So same thing with this. If you have bubbling in your chamber, you're going to start where your patient's incision is, where the chest tube is coming out, and work your way outwards. Follow that tube, trace that tube all the way back to the chest tube system itself, and try to find where that leak is, okay? And that's how you know you're gonna have to replace this. So what are some times that you may need to use this chest tube? You may have an open pneumothorax, a closed pneumothorax. You may have even done something to need this chest tube. For example, compressions. If your patient goes into cardiac arrest and you start doing compressions, if you were doing those compressions right and you fractured some ribs, you may have punctured a lung and you may need to place a chest tube. Doesn't mean you did something wrong. It's just one of the side effects of doing proper compressions. You crack ribs and may need a chest tube. So usually after cardiac arrest, they'll do a chest x-ray to see if there's any rib fractures and see if there's any issues with the lungs. So those are just some quick drive-by notes while I'm on my lunch break, all right? Hope you guys enjoyed that. Please like, follow, subscribe, share, tell a friend to tell a friend. And like I said, if there's ever any other information you guys want to know more about, drop in the comments and we'll talk about it. Got some more stuff coming up this week, so stay tuned. God bless.